In this video, I will be demonstrating the proper way to take and record a client's blood pressure. The equipment we will be using include a sphygmomanometer and a stethoscope. Hello. Before beginning the assessment on our client, we need to make sure of three things. We make sure the client has rested for at least 5 minutes, has not ingested caffeine or nicotine for at least 30 minutes prior, and the measurement should be taken on a bare arm resting at heart level. The client should have both feet flat on the floor and sitting straight up with their back supported by the back of the chair. We lift the sleeve out of the way and make sure the arm is straight and not bent, with the palm facing up and resting on a surface around heart level. When taking blood pressure, it is important that we use the proper cuff size, ensuring that the cuff is neither too big nor too small, as it will give us an inaccurate reading. We will find the artery arrow on the cuff, as we will be lining it up with the client's brachial artery. We will be using the left arm because it is the closest to the heart. Next, we will line up the artery arrow that is on the cuff with the client's brachial artery, placing it 1 inch above the client's antecubital space. We take 2 fingers and make sure they fit snugly under the cuff to ensure that the cuff is neither too loose nor too tight on the client's arm. When looking at the prongs on the stethoscope, it is very important that the earpieces are pointing forward and not backward, as you will not be able to hear anything if they are pointing the wrong direction. We take the bell and tap on the diaphragm to make sure it's on. If not, we twist the bell to the on position. We take our index and middle fingers and do not place them on top of the bell, but instead place them on either side of the bell, and placing the bell directly under the cuff over the brachial artery. We ensure the gauge is in a visible position where we can get an accurate reading, and using our dominant hand, we pump to about 200 millimeters of mercury. Once we reach 200 millimeters of mercury, we will begin to slowly release the pressure at about 2 to 5 millimeters of mercury per second until we hear bump sounds, otherwise known as quarter-cough sounds. The very first quarter-cough sound will be the systolic pressure. The very last quarter-cough sound will be the diastolic pressure. After we hear the very last quarter-cough sound, we release the remainder of the pressure in the cuff. It is important to remember to record our measurements in even number increments, and if taking a second blood pressure measurement, it is important to wait at least 2 minutes before redoing the assessment.